All 4 nations of the United Kingdom are trying to agree on a common approach to the Christmas period and the restrictions that might be needed during that time. Senior medical and scientific advisors said they were working on a plan so that families across the UK might be able to celebrate together as close to normal as possible. But any relaxation of the rules would come at a price. Experts say that for every 1 day of relaxed measures, there would need to be 5 days of tighter restrictions to keep infection rates down. Our health editor Hugh Pym has the latest on the Christmas debate.
Will it be a Christmas nightmare or a dream come true? A question being widely asked as people look beyond the current lockdown in England due to end in early December. Those we spoke to in Manchester were hoping the rules would allow some form of celebration.
It would be nice if everyone could get together and everywhere was to get to back to some sort of normality.
I mean, it would be amazing, and I think like many families we've had a bereavement as well, so it would mean a huge amount to be able to spend the time together.
Senior officials stressed that ministers would decide, but they were open to the idea of a Christmas relaxation.
We are very keen that we have Christmas as close to normal as possible. That requires all of us to make every effort over this national restriction period and even in early December.
So is some sort of Christmas possible, do you think?
So I think it is. Coming into Christmas, we need to be very careful about the number of contacts that we have to reduce transmission. Once we have got past the Christmas period, if there's been a release and some socialisation, we will all have to be very responsible and reduce those contacts again.
Scotland's First Minister set out her position on the Christmas issue.
We are all desperate for some normality at Christmas, and I absolutely include myself in that. And the Scottish Government right now is working very closely and well with the other UK nations to try to agree a way for that to happen.
Decisions in England have to be made on how the tier system might work in December. Officials think the highest tier restrictions in place in the northwest before the full lockdown had an effect on curbing the virus. Daily hospital admissions of COVID patients in the region, which had gone up sharply, have begun to level off and fall a little. Allowing a limited mixing of households is one thing, but deciding what will be permitted for pubs, bars and restaurants is another matter. It's normally their busiest time of the year in the run-up to Christmas, but health officials are concerned that a full reopening will see a further spread of the virus. This bar in Manchester only opened in March, just before the first lockdown. They had to close, reopen and then close again, and they're desperate to get customers back in.
We really need a strong December to make as much money as in normal circumstances as possible in order to get through the first 2-3 months of 2021.
Trade-offs and difficult decisions will be needed on what exactly will open up over Christmas and for how long, and what will have to stay closed.
And Hugh is with me. Hugh, how difficult is it going to be to balance this desire to give people a bit of freedom around Christmas, with concerns about health and the economy?
Well, Hugh, it's going to be a very delicate judgment to be made by ministers at Westminster and in the devolved administrations. How do you get transmission of the virus down and the crucial R number below 1 to show the virus is receding through November into December? And in England, the challenge is going to be what follows the current lockdown from December the 2nd. How do you reintroduce these tiered restrictions? Will some of them actually be tighter than before? And we've learned today this calculation that for every 1 day of relaxation, experts on the SAGE committee say you need 5 to tighten up. So does that mean you might have some tightening before Christmas, then relaxation, and then a tougher regime after that? Or will it all follow Christmas? That's going to be a very difficult call to make. And what about the hospitality sector, pubs and bars and restaurants? It's crucial for them to be trading up until Christmas. They'll really want to do so. But it seems that officials will feel in the area with the toughest restrictions, those areas, it may not be possible at all. So there's the interests of the economy to consider as well. When all's said and done, though, what we've learned today is that health and scientific advisors, 2 governments are working round the clock to try and find something which will work to let families mix at Christmas.
OK, Hugh, once again, many thanks. Hugh Pym there, our health editor. Well, there's more encouraging news about the vaccine being developed by Pfizer and BioNTech. Final trials show it is 94% effective in people over the age of 65. What's more, it's passed safety checks, making it ready for approval by authorities around the world, and it's due to arrive in the UK by the end of the year. Our medical editor Fergus Walsh has the latest.
Yet more good news on vaccines. Last week, Pfizer BioNTech were the first to show their vaccine protected against COVID. Now we have more detail. Pfizer says the vaccine is more than 94% effective among the over 65s and showed the same consistent protection among volunteers from different ethnicities. There were 170 cases of COVID-19 across more than 40,000 volunteers. 162 of those were among the volunteers who got dummy or placebo jabs, and only 8 in the vaccinated group. There were no serious safety concerns, but a small minority of volunteers suffered significant headaches or fatigue.
I think this is good news, and also very encouraging that the vaccine seems to show equal protection in elderly people, because that was a question we couldn't answer after the first announcements last week.
Our immune system usually declines as we age, so it's highly significant that the vaccine protects the elderly who are most at risk from COVID. They should be first in line to get the jab, which requires 2 doses a month apart. Booster doses may be needed, as we don't know how long protection lasts. Vaccinators will go into care homes to immunise vulnerable older residents. GP surgeries will play a crucial role. Some could be open 7 days a week. And large venues like sports halls will be used for mass immunisation. The Pfizer vaccine has to be stored at -70 degrees, which creates some logistical problems, but it remains usable for a few days in a normal fridge. It's thought regulators could approve the vaccine by early December. The UK has bought 40 million doses, but most of these will arrive next year. Nonetheless, it seems increasingly likely that some COVID immunisation will begin before Christmas. Fergus Walsh, BBC News.